Fresh off the press.
Fresh off the press.
Still hot.
Yeah, still hot. A couple of hot blokes.
Look at those blokes. Pecs on the beach. Yeah. What a good title. Random. Oh, I think that was the shot of the whole calendar. We won't have it too close, but that was the best one. The
blue steel.
Blue steel and the
Jason's back.
Mirroring. We get a bit of a front and a back.
Yeah.
Back action in the one image.
G'day guys, Darcy Ninja here. Ninja is fresh off a little lower back injury. He's acute pain, so he's struggling to sort of move and walk around. And today we're going to focus on treating his groins and the things in the front of his pelvis. So we'll have a little bit of an assessment because we know when the body is in acute pain, if you push into that inflamed area, you're probably going to have an adverse reaction. It will help, it will benefit you, and you will heal quicker. But Ninja's got to work today. And if I was to get into that, he's probably going to be worse for wear for the next 5-6 hours. So we're going to try and alleviate some of the pain by treating his hip flexors or groins or whatever's going through the front. So a quick assessment. What I might do, Ninj, is an active straight leg raise with this leg. See if you can raise that leg up or not. We'll whack
doesn't
this
even
one.
want to go.
Can't even move it.
Fuck.
Yeah. So
doesn't want to go up straight.
You probably haven't injured yourself like this in your back for a long time. Years. Yeah. How's that feel?
That's all right.
So passively he's okay. That's all right.
Yeah.
Can you do that? Move your knee in. So go that way. Can you do that? Can you turn out?
Yeah.
Cool.
Not too bad.
Cool. How's activating your hamstring? So pull your heel towards the ground.
Yeah, that's all right.
That's all right. What about your quad push up?
Yeah, that hurts.
That hurts. Okay, so struggling with quad. What about your hip flexors, pulling your knee to your chest?
Yeah, that hurts.
No good.
As well.
Okay. All right. What we might start with, which he's going to hate it, is just seeing if his hip flexors are inhibited from the amount of pain and the pain receptors that are going off. So we're going to just start in that little solace and see if we can just wake this guy up, see if he wants to come to the party. Sometimes treating it can actually have a really good reaction in terms of it sort of stimulates the blood and can help those neurotransmitters and those communicative sort of neurons to act to fire. So we can sort of go, yep, let's switch this on. All right, what we got going on in there is just really tight and sore in the abs and psoas. Is that painful for you or?
Not too bad, man.
Not too bad.
Feels good.
Feels good.
Yeah.
Yeah, gives you a little bit of perspective on what we deal with and when we treat people in pain, Ninj. What are you learning from it, or what are you feeling? Or
yeah, it's just a reminder. I know that this won't be for very long because I've got such a good base of strength and everything, and it's not new. Yeah, but I haven't had it this bad for a good while. Yeah, like last time this happened, it was just one day, and I was the second day I was all good, which I thought it would be take the week. Yeah, and I suppose I want to sprint tomorrow, so I was sort of wanting you guys to see if you could help me get a bit more free, but that's what can happen after treatment. You can take a bit of time to recover and respond. You, like Darcy was saying before, you will be better off in the long run from getting the treatment, but sometimes it stirs you up a little in a way, in order to kind of get things to shift and to move, to change.
So treatment's important, and maybe it is just something that's really overactive and angry, but also it might be stabilizing things as well. So getting his core switched on, or getting his hamstrings and glutes switched on, or even just firing those lower back muscles. But Jace did a treatment on him before, and he ended up a little bit sore and worse for wear, and we had a feel of his lumbar erectors and his lower back and QL, and it was just like rock hard. So the body's just gone free state. That's protect, that's guard that spine from moving any further. The spine moved in a direction or put too much force through it where it's grabbed on and latched on. So I guess the spine was moved into a vulnerable position where it thought there's a threat here. This could really be traumatic. You could really injure yourself here, but the body is really responsive in going, nah, we're not going to let you move any further than that or damage yourself any further than that. And it spasms up and tightens up to restrict any more pain or further damage. So it's clever, and you do need to respect that natural healing process, and just allow yourself to have a bit of time to slow down and look after yourself, if that means you need more rest or more sleep or maybe a little bit more movement in terms of just getting out and going for a walk and getting some sunshine and eating well and drinking enough water and all the little bio habits and hacks you can do to enhance your biology that's going to improve and fast track your recovery. So there are lots of things you can do, and there's going to be some things you can't when you're in an acute lower back or an acute knee or hip flare up. So we're probably here to help guide you and help with your healing journey. Yeah. So not too bad in there, Ninj. Not too bad. Now I'm gonna have to put my back to the camera, but you was telling me that your left groin was probably the worst, or your left lower back. So we know that this adductor complex, we have such dominant, thick, strong adductors in here. Sometimes they can have this connection to our lower back in a way that we release here, and our hip and pelvis starts to sort of breathe in a sense, like it starts to just relax and release. So if we go up into there.
Yeah. It's good.
Yeah. I was even saying to Ninj before, because he's so invested in his health and his food and his diet, he's not going to go and pop painkillers or anti-inflammatories. And I'm not saying don't go and do that. Maybe you do need to, but you know, you can even have anti-inflammatory foods or supplements. You know, curcumin and turmeric and what else have we got?
Like ginger and garlic and things like that. Yeah.
Yeah.
There's plenty of them. You just look them up.
Yeah.
Get them. A lot of times things are just normal foods like cinnamon and nutmeg and cloves are all awesome for you. Yeah. You know, you don't realise that it's just right in your face, but you got to try and have the organic, whole foods. You know, because they don't have the chemical residues on them. But yeah, whole foods are everywhere. You just got to look at them.
How's that feeling, man?
It's all right. Yeah, I'm adjusting to it.
So yeah, it was doing a heavy deadlift, which you've done hundreds of thousands of times in your life from over the last 30, 40 years. But as I said, sometimes it just moves in the direction that the force and load through that part of the vertebrae wasn't the correct way, or grinded just a little bit too much, and the muscles go, freeze that up. Let's stop that from moving for a moment, because you've strained it a bit too much or overdone it.
Yeah.
And that's all right, isn't it?
Yeah.
As you said, your back is going to recover quicker than a back that has probably just been sitting in an office job or bent over concreting, or, you know, not had a body of work through it in terms of weight training and strength training and sprinting and eating well and recovering well and getting enough of these important factors into your life. Not saying it's too late. If you are somebody that spends too much time sitting down, it's not too late. You can start to change your routines a little bit more and get up and exercise and eat well and get enough sunlight and grounding and all these things as well. I'm not picking on you if you think that, oh fuck, that's me. I'm useless. Fuck. I need to go and get out and do a bit more. Well, do it. The new year's coming through now. We're almost in 2025. It's a perfect time to be committed and disciplined, motivated. How's that, Ninja? Brutal?
Yeah, no, it's good.
It's good. What have we got here, Ninja? You want to give him a little spiel?
Yeah.
What's this?
New calendar, 2025. So yeah, we shot it a couple of weeks ago, a week and a half ago. So it's fresh off the press.
Fresh off the press.
Still hot.
Yeah, still hot. Fuck.
Yeah.
A couple of hot blokes.
Those blokes, pecs on the beach. Yeah. What a good title.
Yeah.
Oh, look at that. That's an interesting little spot we got. Close to Melbourne, the Red Bluff, Half Moon Bay.
Geez, you'd be happy to open up in September.
Yeah.
If your birthday's in September, you have to buy it now.
Yeah,
I reckon that's
Aaron and myself in our finest. Let's see, random. Oh, I think that was the shot of the whole calendar. We won't have it too close, but that was the best one. The
blue steel
and the
Jason's back
mirroring. We get a bit of a front and a back.
Yeah.
Back action in the one image. These photos weren't actually edited either, so they come off the camera reel just like that. So, yeah, amazing. Even when we you're there, you look, and I remember seeing Jace doing a plank or something, and Tony just took a shot of it and thought, oh, that's nothing shot. And then I just saw it on his. It's like, you're kidding. That just looks amazing. So he's just this amazingly talented photographer, and makes even old blokes like me look all right. So that's how talented he is. Yeah. So if you want to hire someone to make you look good, have something you can remember.
Tony's your man.
Tony's your man. Fly him out wherever you are in the world. Fly Tony to where you are, and he'll take some good photos of you. It's worth it.
Yep. So we're selling that calendar for $29.95. It'll be in the description below, and we're giving away prizes just like last year. This is our second time doing it. We think we've gone better again. We're giving away 12 months worth of treatment, training, sauna, a whole. What are we calling it?
Overhaul.
An overhaul. Of the word. An overhaul for you in 2025. So what I was saying to you before resonated. Maybe you do need to get into the gym and start training and getting into the sauna and recovery and getting treatment. Fuck, treatment's the biggest thing, because you get to work with people that are like-minded. And look, if you're over the world and you can't come here, well, we're going to do consults over the phone or Zoom or something as well, so we can do those for you no matter where you are, and we'll still get plenty out of it and put plenty of effort into making sure you're getting value for your buck. But for $30 Aussie to $29.95, it's even cheaper. Not only are you going to have a cool calendar on your wall, you're also going to be in a chance to win one of 10 prizes. So that top one is the biggest, and it just halves its way from there. So 6 months of treatment, 3 months of treatment, and then a few 60-minute treatments from the experienced senior body workers. So get it today. You won't be disappointed. We put in a lot of effort. We had fun doing it.
Yeah, it's a bonding experience for us, isn't it?
Experience.
Yeah, we love it. I think I'm feeling better, Darcy.
I think you might be feeling. Look at that. We just talk and we just get that moving, and
it's good for that first bit. That right at end range, it's still pretty.
Yeah, a bit grabby. So think of the pelvis rotating, coming through, and how if you've injured yourself in a flexed state, it probably isn't going to enjoy flexion, and that's what the pelvis bringing forward is doing to that. So we probably want to get a little bit more extension and encourage, the pelvis down this way a little bit as well. So I might just sit in there for you, and yeah, that's so ropey. I don't know if I've felt your hips that tight before either. It's interesting how it's not just the back; it's the whole hip that gets tight and seizes up. But yeah, adductors. If you've got lower back pain, don't be scared off thinking, "Oh, I don't want anybody to touch me." Get in, get your hip flexors, get your adductors, get your quad tendon, or wherever you feel like, wherever we feel like is necessary, we will assess, and it'll be specific to you and treat you accordingly.
It's good, Darcy.
Yeah. What are you going to do today, Ninja, before your 1:30? Tell us, as a person that's experienced in this field, what's Ninja going to do to get his body right for tomorrow?
I think like the explorative movement, so dynamic warm-ups. So yeah, just getting exploring. I got to explore into the left side. That's where my It's just sort of, it's interesting because your body's normally relaxed and then all of a sudden it's fucking jacked up, protected. It's like you're just not expecting, like that ropiness through my quad there.
Yeah, it's just all very gristly and ropey.
Yeah, just there, man. It's just something's in there that's connected. So,
not a lot of pressure, just the right point. So some dynamic movement, maybe a sauna.
Yeah, I got infrared sauna here. Maybe go and switch that on. And hot tub.
Hot tub.
Yeah. Might be the
remedy.
Just even you putting your thumb here, man, that's fucking killing me.
Yeah.
Far out, that's tender.
Yeah.
Oh.
Just leaning on his quad.
Oh, man, something's going on, fuck.
Yeah.
Oh,
yeah,
dear.
Not used to being the injured person. We're used to treating them. So, yeah, we learn, you grow, you get a little bit more insight, a little bit more understanding, compassion or empathy or whatever comes with being injured, and the next client that has that, you have a better understanding of what their experience may be because you've had it. And that's why the good body workers need to have the compassion on, or sometimes have had traumatic injuries and been through the experiences themselves because they know exactly what the body needs to get back, and they're a reflection of that.
Far out. We need the pain, don't we? That's where all the growth is, the learning.
Yeah.
Pain is an invitation to evolve.
Yeah. So we probably found that his psoas wasn't too bad. We've got a whole lot more going on in this pectineus, little guy in the hip here, and the quad and the groin. The psoas, which we started with in the hip in here, was okay. So explorative treatment as well. Feel where it's necessary. Don't waste your time on spots that aren't relative, And looking forward to Friday, Ninja. You're going to have to get your body right for that too. You've got to put your best dancing shoes on.
Dancing out on the track.
Yeah.
Yeah. You got some gear organised, have you?
Yeah.
You've probably got a whole wardrobe full of...
Yeah, I've already got a wardrobe full. I'll just pick something on the day. I think it's going to be 34 degrees, so that's hot. To be wearing a full suit and tie, so I won't be doing a full suit and tie. It'll, nice shirt and some pants.
Or no shorts?
No, I don't think I'll go shorts. I don't know. We'll see.
I think Elliot's going to steal the show. He's going to wear his wedding suit.
Oh, good on him.
Pink suit. So that'll be cool to see, eh?
Need a purple one.
Should go and buy a purple suit. See if I can find one. What do you reckon?
Why not? Sinking out of that, and then it was really sore before, so we're going to give Ninja a bit of curry here.
A bit of quad.
And just pin this quad junction point, which I feel like I can just probably tensen up a bit, so if I come in that a little slower and then try to get as deep as I can, just melting into that tissue. So go slow, pin, and then hit this 45 junction point, which we find, a lot of squat. Well, a lot of the movement we do when squatting is quad dominant as well. So tight quads, pulling on the pelvis anteriorly, pulling it downward can compress the lower back as well. So just releasing this allows the pelvis to sit a little bit more neutral and less like a tug of war. We don't want the back pulling up and the quads pulling down, and it just ends up with friction in one area, and that can cause some pain. So probably not too bad.
Yeah, there's one specific spot one there that was sort of just nervy or something for me. It's weird when you hit a spot that not much pressure on there. And it's
just goes.
Yeah.
Yeah. Don't mind him. Let's, just before the video finishes, I want to have a go at his other adductor because, yeah, it's in a way this is a video, but we're also trying to do a bit of a live, real treatment. Ninjas, you know, we put these challenges out, you know, to lift and sprint with the whole team. And I know how much it would mean to Ninja to be able to sprint tomorrow, and I'm sure he will, but I'm sure there's a little guy in the back of his head that would be pretty annoyed and frustrated and pissed off if he can't.
Yeah, that's it. Yeah, it's my thing. My show is a sprint.
Yeah.
I suppose both those shows are mine. I've kind of been fostering for so long now.
Yeah.
Sprint one's been 14 years.
Yeah.
And so, but lifts has been 24.
Yeah.
Nearly 24 years now. I've been running a Monday night lifting. So, yeah, you've got to turn up to your own show, haven't you? You can't be telling people what to do. You've got to walk the walk. We love exemplification.
Yep.
It's our word. And, yeah, I love being mobile and agile, those kind of things, being powerful, strong. So, yeah, that's what we want to be. Happy, healthy, and strong.
Yep.
Bit of Wim Hof.
Happy, healthy, strong.
Yeah.
Clean first, build second, live free.
Live free. You're going to be free.
Yep.
Free of pain, free of the burden.
Yep.
You know, the challenge is always going to come in life, but it's how you respond to them. It's the important thing, isn't it? So, I'm not going to give up on this.
You'd be
facing it.
You'd be pretty... what's the right word? If you lived a life without any challenges, you know, you'd I don't even know what I'm trying to say here, Ninja.
You get them in the end anyway.
Yeah.
You know, it's the comfort culture is what the challenges come out of that, because if you you don't move your body, you're just eating takeaway food and processed food and things like that. It's all kind of pleasure and things like that for a start, but then all of a sudden you can't do the things because you can't move and your health's not there, your energy's not there, and you can't do the things that are actually cool in life is, you know, going on a hike or picking up your kid or, you know, playing some sport. You know, you should want to just participate. A bit like a dog. I like the dog's attitude. They just fucking want to run. Yep. You know, they go to the park and chase a stick or a ball or something.
They're always happy too.
Pure joy for them, isn't it?
Unconditional love.
Yeah.
Fuck.
The dog's good.
Yeah. What's it got to take to feel unconditional love these days? Bloody hell. The dog will. Go get a dog.
And mum.
And mum. Mum and dog. Call mum. She'll fucking love you forever.
Unconditional.
Yeah. Well, most days. She might fucking hate you tomorrow for a minute.
Yeah, even if you don't have your mum anymore or something, there's still somebody that is a mum figure.
Yeah.
Be there for you.
Nothing's missing.
Nothing's missing. It might be across 10 people that is your mum, you know. So, yeah, they'll kind of accept you and, you know, want what's best for you. Be unconditional. But yeah, that's the human condition, is to have conditions.
Yep.
We kind of, if you don't do this, you don't get that. That's the way she works.
We're on a good one there. He's just bloody hit nos. He's turned it up a level. He's changed gears and he's fucking... It's good. It's good.
Yeah, I'm getting better already.
Yeah. See, laughter's the best medicine too, guys. If you're not laughing and smiling, having a little bit of fun, you're stressed and overwhelmed and down and depressed, I don't think your body can heal. So go and laugh with your mates and have a little bit of fun and joy, because laughter's the best medicine.
That's it.
We might finish on that note, guys. Remember, description below, you can buy the calendar. And yeah, if you've got acute lower back pain, there's so many things you can do to help yourself. Don't just sit there and feel sorry for yourself or pop pills or stay in a dark room. Get out, move, get some sunlight, get some treatment, and yeah, sauna, ice bath, all those types of things, anti-inflammatory foods, all those types of things can really help you out. So if you like this video, make sure you do give it a like, a share, subscribe, and head to our Patreon for more exclusive content. And thanks for watching.
Thank you.
Done!
Done!
Fucking done! We were just sitting here having a little bit of a discussion, seeing how Ninja felt, and already he couldn't lift his leg up off the bed. So just goes to show how important, how effective treatment can be. How's that feel for you?
Yeah.
Way better.
Yeah.
You'll be sprinting tomorrow.
More confidence now.
More confidence. That's the thing, the empowerment that you can feel, because when you're injured, you are down in the dumps. You're like, oh, it's the worst thing in the world, especially your lower back, because you can't fucking put your shoes on or bend or flex your hip. So huge improvement. It is effective. Treat the hip flexors. There's some good results at MMT once again.
Yeah. Oh. Mentally better too, huh?
Yeah,
that's one of the main things.
That's the thing, mentally.
People get depressed when they got pain.
Yeah.
It affects all areas of life, doesn't it? So.
Yeah. Awesome, man.
Yeah.
Beautiful.
Work on it.
Work
Deal with
on
it.
Just goes to show.
Get it done.